So hi everyone, can you hear me? Pretty good?
Yes.
Yes, perfect. Good morning again, everyone. We're gonna get started. This is concurrent session number 4, in which we're going to be talking about the COVID-19 recovery as it relates to health. My name is Jose Marco Paredes, and I'm the Director of Civic Engagement for the Latino Policy Forum. But to whom you want to hear, it's our group of experts that with us we have today Xavier Nogueras. He's president of Boca Media Group and co-founder of Illinois Unidos. We also have Leticia Bouton-Price, CEO and president of Illinois Community Health Association, and Marianne Tomasic. She's from the Center of Health Law and Policy Innovation of Harvard Law School. Thanks to the three of us. We really appreciate your time and joining us in this 2021 Latino Unity Day. And to all the attendees, I want to remind you that we're going to have some time for Q&A. There's a little button in the bottom of your screen which says Q&A. Please remember to include there your questions, and for sure our panelists will do the best to be able to answer them. With that said, let's get started. Xavier, thank you so much for taking the time to talk to us, and thank you so much for the amazing work that Illinois Unidos has been doing for the Latino community during this terrible pandemic. The floor is yours.
Thank you. Well, let's talk a little bit about Illinois Unidos. Many of you know about Illinois Unidos, but let's just in case some of you who don't know, Illinois Unidos is a consortium of over 100. Actually, we're now reaching close to 200 health professionals, community-based organizations, elected and appointed officials, and interested professionals. The initiative aims to present one united voice in stopping the spread of COVID-19 in our communities while addressing related public health issues and the devastating economic impact of COVID-19. The partnership is the largest of its kind in the country and is actually being replicated now in several states. It's actually a partnership that has reached out to us and is actually doing something similar in California now. The initiative started, we actually just celebrated, well, not celebrated, recognized our 1-year anniversary a few weeks ago, where, basically some local communication specialists, myself, Cesar Rolon, we decided to convene an emergency meeting when we realized as the devastating impact of COVID a year ago, there wasn't a space where the Latino community was talking in one voice. We convened a Zoom meeting. We thought we'd have 15 people, some elected officials, community folks, some doctors, over 40 people showed up. And from there, we decided that this was a good space and that we would continue to the point where now we average, over 70 to 80 people per meeting that we hold every other Saturday. And the group has really become an important voice in leveraging things for our community to combat COVID-19. Like I said, we meet every other Saturday. We now have 5 committees that meet throughout the month. And since then, Illinois Unidos has been providing good tension to challenge how equity has been viewed and how our story was being told. Some of the things that we've been able to accomplish: we've been able to influence policy and leverage more resources for Latinos in Illinois, introduce strategies that various health departments have adopted now. We've been able to challenge the way data was being used to determine need and equity in our community. For example, hospitalization rates were being used to determine equity. And the truth is that in our community, many of our folks weren't going to the hospital. We've been able to leverage millions of impressions on local, national media. We actually just finished producing a half-hour show that was played on Telemundo, that was played several times. We've established a bilingual website, illinoisunidos.com, that has since then gotten over 100,000 hits, and so much more. We've established a working space for Latinx doctors, health professionals, and nurses. And more importantly, we've been able to create a space where we speak in one voice. But there's a lot more work to be done. We are now facing the challenges of vaccine hesitancy, which is becoming a major problem. We're currently involved in a study about COVID long haulers, which I'm sure we're going to talk today, which is basically going to be the effect of COVID after this pandemic and how it's affecting people's health. all sorts of stuff that is being discussed today. And we've actually been able to raise over close to $1 million in non-government funding that we are using and giving back to the community. And actually, we're going to start using some of that in some of the vaccine hesitancy campaign. So it's been a busy year, but united, we've been able to do this as one community. And if COVID did one thing, it definitely united our community to work together. So we're real proud of the work that you all here are doing, and the work that everyone in Illinois Unidos is doing. Thank you.
Thank you, Xavier. I have a question for you. This is a volunteer-based group. If there's anyone on the call who would like to join one of the committees that Illinois Unidos have, and can you talk a little bit about those different committees that are working inside Illinois Unidos that would be helpful?
Yes. So we have a health committee, which is really the original committee. So what happens is every other Saturday we meet as a comunidad, as one village, to really report, but the work is really done in the committee. So we have a health and policy committee that's actually chaired by Dr. Marina Del Rios. And if you guys remember her, she was the first to be vaccinated in the state of Illinois. We have the policy committee that's headed by Latino Policy Forum. We have an education committee. We have a workforce safety committee, which is really, really important and is actually really influencing some of the policy that's happening now. And then there's a Promotoras de Salud committee. All you have to do is go to IllinoisUnidos.com, real simple. And by the way, it's a great site. It's a real simple site where folks all around Illinois, there's a lot of focus on Cook County. There's a lot of focus on Chicago, but this has been devastating in Lake County, Will County, Southern Illinois. And so the site has been a sort of a relief for a lot of folks who are kind of disconnected, and they sort of, they connect with us and then we kind of reconnect them with resources and organizations all across the state. But IllinoisUnidos.com is where you can contact us.
Thank you so much, Javier. We really appreciate your time. And just to remind everyone that we will have some time for Q&As. If you want to ask any questions, please remember to text us at the Q&A button. Next, we have Leticia Butzenfry, CEO and President of the Illinois Community Health Association. We also have with us Marianne Tomasic from the Center of Health Law and Policy Innovation at Harvard Business School, Harvard Law School, apologies. Thank you both for joining us today.
Jose Marco, I'm sorry, Representative Delia Ramirez was able to join us again to talk about the Medicaid expansion bill. My apologies to Leticia and Marianne, if you could just hold on for a couple of minutes. She wants to share with us where the bill is at and what it will do for the Latino community. Thank you, Leader Ramirez. Thank you.
Thank you. Hi again to some of you. So good to see Xavier on this, my constituent and a true leader on health and all things social justice. So I wanted to just mention to you, as you all know, we obviously made history when we were able to expand Medicaid coverage to undocumented seniors last year. But Healthy Illinois Coalition and a number of us in the Latino caucus are working to continue to move that needle, ultimately to get to a place where if you are eligible for Medicaid coverage, it doesn't matter your legal status, you'll be covered. We all know that process isn't always the overnight process. So what we're really trying to work on is to keep bringing down that age group. Right now, if you're 65 and over, undocumented and eligible for coverage, you will get it. It's why by March 31st, over 4,000 undocumented seniors had applied and are now covered. It's major. We also know that means that we have a severe undercount of our undocumented seniors because we projected that to be one fourth of that number. But what I want to ask you is of your support. The Latino caucus is making this a top absolute priority in the House and Senate, and our other colleagues from the Senate and the House need to hear from you that we have to further expand this. COVID, and I'm sure Xavier just talked about this, has made it really clear the disparities and what happens to our essential workers, especially those in that 45, but really that 55 to 64 age group, where they're still essential workers, they're still working at factories, they're getting sick, they have diabetes, and they're not getting preventive care. My hope is that we can move the needle to 55 this time around, and we'll come back next year and keep bringing that down. And honestly, there's a likelihood that we can make it happen. What I'm being told is that they need to hear from everyone how important this expansion will be. So I need your help. Call your senators, call the state representatives, call the speaker, call the Senate president, call the governor's office and say, we have to further the Medicaid coverage to include our adults 55 and over. All of them, but at least 55 and over this session by May 31st. And I think we can make it happen. So that was just my plug coming in here. And I'll take any questions before I step out. And I know the other panelists will also be speaking.
Does anyone have any questions from Leila Ramirez? Anyone has some seconds to put it in the Q&A?
While somebody's asking a question, I have to really commend Representative Ramirez, especially when the issue of housing and COVID. It has been incredible what she has been able to do and push. And like I said, when it comes to long haulers, this is just the start. The effect of what's going to happen and the economic devastation is going to be something else. And I just had to really commend Ramirez and all her work she's done with the Illinois Latino Caucus.
Appreciate it, Xavier.
I have a question. Hi, Representative Ramirez. My name is Letitia. I wanted to know, is there a, like fact sheet or some information, because we would love to, get that out on the Illinois CHW Association's communication channels.
Around the expansion? Absolutely.
Yes.
We'll do that. And one of the things that you'll find is that it is saving the state 3 times as much covering this population than it is not having them covered and having them come into a hospital with stage 4 cancer. So we have a fact sheet. Leila, I'll work with you to make sure we can get it to the group. I appreciate that. Thank you.
Well, it seems we don't have more questions. Representative Ramirez, thank you so much for popping in and for being in these 2 sessions, consecutive sessions that we have. We really appreciate your time. Thank you so much. And now we're going, Leticia, Marianne, the floor is yours. I believe that you have a presentation. I'm gonna share my screen and I can pull it up. Thank you.
Sure. I just wanted to give a little background. Letitia Bowden-Price, President and CEO of the Illinois CHW Association. I also want to recognize my partner, Wandy Hernandez-Gordon, who is unable to be with us today. But we are a membership organization for community health workers throughout the state of Illinois. And under that umbrella also includes Promotores de Salud. And so we have been working very diligently on some legislation, and it is historical for the state of Illinois and our community health workers. So we are pleased to be here. Thank you so much for this invitation, Leila and Jose. And so with that, I'm going to turn it over to Marianne, and then we'll answer questions.
Thank you so much. Good afternoon, everyone. My name is Marianne. I'm a staff attorney at the Center for Health Law and Policy Innovation. We're a clinical teaching program at Harvard Law School where 2nd and 3rd year law students can spend a semester with us working on a health law and policy project. Unfortunately, the student who's been working with me on community health workers in Illinois is, unfortunately for us and her, is taking a final right now. So I am standing in for her. So as Leticia had mentioned, I'll be talking about a part of a new law, Public Act 102-004, that was introduced by the Illinois Black Caucus and includes a provision called the Community Health Worker Certification and Reimbursement Act. And this part of the new law lays the groundwork for community health workers in Illinois to ultimately get paid through Medicaid for the very important services that they provide. If we could go to the next slide, please. So as many of you know, community health workers are frontline health workers who have a trusted relationship and a close understanding of the communities that they serve. And through providing patient navigation services and coordination of care, community health workers are often able to improve health outcomes for their patients and also help avoid unnecessary healthcare costs. And these types of services are especially important for communities that have historically been underserved or misserved, and for people who may not understand the United States healthcare system or who may not be fluent in English. And as Representative Ramirez mentioned, trust isn't an overnight process. And so it is even more important that the trusted people within the community are able to join and thrive in a workforce and help connect people to care, especially with the potential of expanded access to Medicaid. Go to the next slide. So this is close to home for me. I like to share a quick story about my gongong, as you see the picture here with a very young Marianne Tomazik. I come from an immigrant family where my maternal relatives speak Chinese and either do not speak English or started speaking English as a second language as an adult. And my grandfather, who only spoke Chinese, was prescribed a blood thinner by his doctor, and he and my family who had went with him to the doctor's office left knowing that he was to take a specific number of pills each day. However, when they went to the pharmacy to pick up the drugs, the pharmacy didn't have the dosage that the doctor had thought would be prescribed, and so each pill was actually in a higher dose. And while I'm sure the label and the pharmacist said to take a fewer number of pills, what my family didn't quite understand, and what they remembered was what the doctor said. And so my grandfather ended up taking too much of the blood thinners. And while luckily it was not a fatal episode, he didn't have any emergency at home, but a blood test later found out that he had unintentionally overdosed. And he was admitted to the hospital to treat the overdose and monitor for internal bleeding and other complications that could arise. And so here, a simple miscommunication across a language and a cultural barrier led to high medical costs that probably could have been avoided if there was a knowledgeable person that my family trusted within the Chinese immigrant community who knew how to navigate our segmented healthcare system and could coordinate care, and probably could have caught this misunderstanding sooner than the blood test did. So for me personally, there's no question that a community health worker workforce needs to be woven throughout the healthcare system. However, sustainable funding has always been a prominent issue, and something this important ought to have a strong foundation in the healthcare system. So if we can go on to the next slide. For the last couple of months, TILPI has been working with the University of Illinois Cancer Center to consider various opportunities to support a diverse and sustainable community health worker workforce. And once this bill was introduced, we refocused onto the bill's language and started to work up an analysis of what some of the key questions might come up with implementation of the law. So if we go to the next slide. So today I'm going to spend the next 10 minutes or so highlighting a few of the many decisions that the state and other stakeholders will have to make when implementing this law. For each decision, I'll emphasize some of the important considerations that should be on our minds and a couple of examples of what other states have done across the country. So first, I'll talk about community health worker training. Go to the next slide. So the Act calls for the availability of multi-tiered academic and community-based training programs. The Illinois Department of Public Health, along with state education boards and the Illinois Community Health Workers Association, are to develop protocols to certify these trainings. And while training programs can help standardize and legitimize the profession, training requirements can also create barriers to entry into the field if they're not designed inclusively and accessibly. And since it's so essential that community health workers have an intimate understanding of the communities they serve, we proposed a goal of ensuring that training programs develop core competencies and skills while supporting a diverse workforce that reflects the makeup of communities. And that is in terms of race, gender identity, sexual orientation, and socioeconomic status, and also in terms of disability and chronic health conditions. So keeping that goal in mind, we'll move to the next slide to talk about some of the decisions that will need to be made about community health worker training. So one major consideration is cost. Illinois may consider putting a cap on the amount that training programs can charge or can sponsor trainings themselves or subsidize or cap the cost for each training. New Mexico offers some free online trainings that are designed and managed by a nonprofit organization. Another major consideration is length, making sure that trainings are not too long and that they're offered in a flexible manner that allows those with jobs, those with childcare responsibilities, or other health conditions to participate. Some states have standardized hour requirements for trainings while others do not. Some states tend to be a little bit more flexible in certifying trainings of different lengths. Training should also be available in different languages, particularly those most spoken in the state and those that are spoken by the communities that are priority to serve. Online training options are also a great way to ensure that these trainings are in all the available languages and that they're also available to people who are in rural or remote parts of the state. And then move on to the next slide, please. And then finally and importantly, training should be designed with community health workers with disabilities and chronic health conditions in mind. Pre-recorded trainings that can be accessed at any time allows trainees to work around their own schedules and around their health and well-being, especially for people who have themselves multiple medical visits or who have chronic conditions where their energy levels may be high one day and low another. So moving to the next slide, we will go from training of community health workers to individual community health worker certification. Next slide, please. The Act calls for the development of a community health worker certification board. And this board will develop and oversee certification for training programs and to certify individual community health workers. Certification will be important as this will be a requirement for Medicaid reimbursement. And like with trainings, we have proposed a goal of developing certification requirements that ensure that a qualified ensures the development of a qualified workforce, but do not create a barrier of entry to the profession. Next slide, please. Thanks. So with that goal in mind, we can think about what certification requirements should ideally look like. And the board, first and foremost, the board will have to set individual community health worker requirements. Some states require a combination of work experience and training. Others will look at just what kind of work experience you have, and other states require only the completion of a certified training program. And the board will also need to determine how to certify community health workers who are already serving their community. And so some states have more restrictive requirements than others, and Illinois will want to consider how grandparenting requirements may be a barrier, both in time and also in documentation. And in developing grandparenting requirements, the board should also think about pathways for new public health workers who have entered the workforce to support vaccination or education efforts during the COVID-19 pandemic, so that they too can also become certified community health workers. And then one other important decision to make is whether Illinois will consider a candidate's criminal history as a factor in whether or not they can become a certified community health worker. The disqualification of community health workers based on past criminal legal system involvement could be a significant barrier to entry to the field. And this is especially true for people of color who are overrepresented in incarcerated populations, and for people who may not have been in a financial situation where they could hire zealous legal representation or even just navigate the legal and criminal system. In a survey done in Louisiana, community health workers and their employers both emphasized that people who were formerly incarcerated or who had a criminal history often reflected the communities that most needed to be served, and thus brought valuable experience as a trusted member of the community. Now, a few states like Massachusetts and New Mexico require community health workers to submit their criminal history, while others do not. And so if Illinois does feel strongly about including a criminal background check, it should set clear, transparent guidelines about how that history will be considered. And as one example, Massachusetts only considers convictions and open cases, but not arrests or juvenile offenses. Additionally, a criminal history does not automatically disqualify someone from becoming a community health worker, as they also consider mitigating factors and evidence of rehabilitation. Next slide, please. So now I'm going to move on to perhaps one of the most important parts of the Act, the opportunity for community health worker services to be reimbursed through Medicaid. Next slide. So the Department of Healthcare and Family Services will have to develop a list of community health worker services that will be provided by Medicaid. Our proposed goal is for Medicaid reimbursement to be available for a wide range of services, such that community health workers have flexibility to adapt to the needs of the communities they serve. Not all communities will need the same services, but certainly all services should be covered. Next slide. And so, so the decision point here, of course, will be what services will be covered by Illinois' Medicaid program. And as an example, I'll turn to Oregon. Oregon's billing codes cover a broad range of community health worker services, including preventive medicine counseling, home visits, substance abuse screening, etc. However, the billing codes don't include a few essential community health worker services, including blood and other laboratory testing, so thinking about COVID-19 testing, and patient transportation. And so if these areas are important, or other areas that I didn't mention are important to Illinois community health workers, this might be an area for future research and stakeholder involvement. It would likely be helpful to see, one, if any states currently reimburse community health workers for those services, and then two, if any states have had unsuccessful attempts at having those services covered, and to see if there's any lessons learned with the advocacy there. Next slide. And so now I'll move on to another important aspect of reimbursement, which is supervision. Next slide. The Act requires that community health workers be supervised by an enrolled medical program provider in order for their services to be reimbursed by Medicaid. Our proposed goal is to strike a balance and ensure that supervision requirements promote the provision of quality services and the integration of community health workers into the healthcare system without restricting the provision of services. Go to the next slide, please. So the first decision point here is that HFS will likely have to define what is an enrolled medical program provider. While most states that do require community health workers to be supervised require that the supervisor be a licensed medical professional, the language in this law is more vague. It doesn't necessarily say that a supervisor has to be a doctor or a nurse or some other licensed provider. So HFS could have the discretion, for instance, to develop a tiered approach where specially trained community health workers become supervisors who supervise other fellow community health workers. This also helps create a career ladder and creates a more sustainable workforce. HFS will also have to determine the level of supervision that's required. Requiring supervisors to be physically present, for example, could create an obstacle for reimbursement, particularly for services like home visits. So thinking back to the case with my gongong, if a supervisor needs to be physically present, that might have limited a community health worker's ability to visit him at home, to look at the pill bottles, see what he was taking, or even help transport him to the pharmacy and help navigate that point of care too. Next slide. And so finally, I'll be talking about integrating community health workers into Medicaid managed care plans. So HFS is going to amend contracts with managed care entities to allow them to employ or subcontract with community health workers. while certification and supervision is required for reimbursement by Medicaid, managed care entities have the discretion to hire a contract with community health workers who are not certified if they use their own funding to pay for those services. And since I believe over 80% of Medicaid beneficiaries in Illinois receives their services through a managed care plan, our proposed goal was pretty broad and just to encourage managed care entities to utilize community health workers. Next slide, please. So here, HFS will need to decide how this will manifest in managed care plans. The agency can include language that encourages managed care entities to utilize community health workers without mandating their use. This is something that Massachusetts did. And they encourage the health plans to use startup and ongoing grant funding to invest in a primary care workforce, which included hiring community health workers. And then while managed care entities can employ community health workers directly, having employed community health workers could raise issues around patient trust. So alternatively, there's also room to explore with community-based organizations and clinics, having agreements with managed care entities so that they can hire the community health workers and be reimbursed for their services. And in Mexico, this has been structured as some of the managed care entities provide a per member per month agreement with clinics who then employ community health workers that provide services to beneficiaries. So the key question here will be just what kind of solution works best in Illinois and how state agencies and other managed care entities can help get us there. And so the last slide, please. So in sum, this law is clearly a super exciting opportunity to integrate community health workers in a very meaningful way in the Illinois healthcare system. But the devil's always in the details, and there's going to be a lot of questions coming up. One thing that I did want to highlight is that with the development of all of these details, there's also the question of funding and how to make sure that this implementation of this law remains a priority. And the American Rescue Plan Act, which is the most recent COVID-19 Relief Act, made over $7 billion available for the federal government to distribute to state and local public health departments, a part of which included some money that was set aside to recruit, hire, and train community health workers. And so, for one, as the certification system is being established, there might be a way to draw in some federal money and help grandparent in current community health workers. And that might be a fiscally smart thing to do at this time. But then also Xavier's been talking about long haulers, and man, we don't know the long lasting impact of COVID-19 and the amount of care coordination that is to come, not only to make sure that people get the care that they need decades later, but also that public health researchers are able to stay abreast of these developments and identify when certain long-lasting effects can actually be connected back to COVID-19 and drive more research into treatment options. I believe it may have been dropped in the chat. We also have 2 additional resources that may be helpful. One is a one-pager that just summarizes the key points from the new law. So that might be just helpful for general education. And then the second one is we kind of took some of the questions that I highlighted here and dropped it into a discussion guide. Should folks want to have a conversation that's a little bit more in depth and bring various stakeholders to the table, there are some questions and some additional state examples there that could be helpful. Thank you. And thank you, Jose Marco, for helping with the slides.
Oh, thank you so much for the presentation. Really proud that I didn't mess up with the slides. These are the 2 resources, the 2 PDFs that I just put in the chat that you wanted to share with the participants, Marianne?
Yeah, so the first one is the one-pager, and the second is the discussion guide that breaks out. I believe there are about 7 to around 7 to 8 questions for each, for training, for certification, and for reimbursement. And they're kind of open-ended, so it encourages people to come together and brainstorm and hopefully come up with some concrete next steps for the state to take.
So Leticia, Xavier, thank you. Marianne, thank you so much. I don't know if any of you have a final comment while I check the Q&A and see if some of our participants have any questions for you. Do you have any final comment?
Yes, I do.
Great.
So ILCHWA, the Illinois Community Health Worker Association, is committed to, having the voice of community health workers and promoters at the table while they're making these decisions about our workforce. We are also committed to reducing the barriers for CHWs and promoters who want to be certified, but then also putting in parameters and speaking up for our CHWs and promoters that don't want to be certified. So not to hinder or hurt those workers who don't want to be certified, because we've been in this work. ILCHWA, who was formerly known as the Chicago Community Health Workers Local Network, since about 2008. And we've been doing plenty of surveys, plenty of forums, plenty of you name it, to try to get as much information from the workforce itself, but then also allies, supporters, and people that just may oppose the progress of community health workers in Illinois. And we have learned that, some people believe that by professionalizing the workforce, it just takes away the essence of community health workers, which is just the unlearned, just innate ability to care and love the communities that they are from, but then also the communities that they serve. And so you can't teach those types of things. And so that's why it's important, as one of the as a definition for community health workers, that they are from the communities that they serve, but they just have this unique, close understanding of the communities that they serve as well. So we're committed to that, but then we also just invite you to participate in our committees. So we have a committee on certification, financing, and reimbursement that looks at this act, but then also the implementation of the act. So within the act, the Illinois CHW Association is named as one of the collaborating partners for the implementation of this, but we are definitely trying to ensure that we are representing people and hearing their thoughts and their voices and bringing their concerns to the table as well. So ilchwa2018@gmail.com, that's the Illinois CHW Association's website. And if you send us an email, then we'll send you the invite. We meet once a month. But as Xavier noticed, some of the work comes outside of those monthly meetings. And so we welcome your participation, as we are definitely moving forward with implementing this public act in the state of Illinois.
Leticia, thank you so much. Xavier, do you have a last comment?
Yes. I have really an announcement that this is going to be the first time we're kind of going to make today. There's a lot of issues with vaccine hesitation. It's very, very real, and it's growing. And so Illinois Unidos is really proud to announce that, with Cesar Rolón and Mobile Vax, we're actually, before we were fighting to get mobile vax and vaccination, right, in our community, and, this community didn't get it, that community didn't get it. Well, we actually can come to your community now. We know that we're going to, on May 16th, we're going to Brighton Park, May 22nd, Melrose Park with the mobile vax. We have the capacity of vaccinating anywhere from 250 to 300 people. To 500 people. But I want to let people know here that if there is like a business corridor where people of color are at, where people who need the vaccination, we now can go to you. So there's no excuse. You want to set up shop in your neighborhood, if you could get the volunteers, we can actually come to your neighborhood and vaccinate 200, 500 people. That's big news. So contact me, let me know. And just a quick shout out on the community health worker certification. That is so huge. I hope people understand how big that is. I'm sure our promotoras committee know about this, but I'm gonna make sure y'all are connected because it is everything. Like this is huge. So thank you for the work you're doing with the community health worker certification. And hey,
Appreciate that.
bring us, you need vaccination in your neighborhood. Let us know. Before people were fighting for it. Now we can come to your neighborhood. Let us know.
So we want to thank our 3 speakers. Thank you so much for bringing this great information. Thank you so much for the work that you do. And to the rest of you, just a reminder, if you want to continue with the agenda for the Day of Latino Unit Day, please stay connected. We have a really great agenda, and you're lucky enough if you're joining this session, right, and not the education one, because folks are going to have 5-minute break. In our case, you're going to have 9. So that was great that you joined the session. And at 12:15, please remember to, I think Lila just put the link to the general session. We're going to be talking about redistricting. So thank you so much. Thanks, everyone.